Non-communicable diseases are now one of the leading in terms of burden for illnesses and even for death. Right now NCDs are the leading in the country and even globally and even regionally. And we are disproportionately affected as Africa. And the reason why we really need to put our heads together, we need to have all the sectors on board so that everybody brings their input. Our population is seriously affected, particularly sickle cell disease in the 17 endemic counties in the western belt and also the coast. And this is being a very huge burden to the county's economies. It may not be very clear, but the loss that comes from these conditions is quite high. And it is time that the county government and the partners concerned come together so that we find solutions of addressing some of these issues.
Serikali kiasi imetusahau. Tuko hapa kwa minajili ya kuona serikali, tunalia serikali kapate kutukumbuka pia, kwa sababu sisi ni watu ambao tunaishi hospitali kila wakati, tunatumia dawa, hospitali zenyewe ziko mbali, kupata hata ukifika huko kupata dawa ni shida, unakosa na unatumwa ununue nje, na hali ya fedha pia imeharibika katika nchi. So tunateseka na ni serikali tu ambayo inaweza kutusaidia, kwa sababu hatuna mahali pengine tunaweza kukimbilia isipokuwa serikali yetu ya Kenya.
We are not helped. Hapa kwa county hatupati services venye inafaa.
Most of the people walikuwa wanakufa, wanasema kwamba ni ugonjwa ya uchawi, wengine wanasema ni ugonjwa wa kimapepo, wengine wanaanza blame games. Most houses zilikuwa relationships zilikuwa zina break. Baba na mama wana separate, alafu wanaacha mtoto katika matatizo. Na hii hali ya kuacha mtoto katika matatizo huwa inafanya most warriors wana commit suicide, kwa sababu wako rejected na both parents. Stress inaanzia nyumbani, ndio inafika kwa community na ndio inafika kwa society.
Sickle cell disease, just like any other disease, is something that can land in a family, especially for people who are living in sickle cell disease endemic regions, that is regions along the lake and regions along the coast. Just to mention a few counties like Migori, Homa Bay, Siaya, Kisumu, Bungoma, Busia, Kakamega, countries that are along the lake belt, and also the counties that are within the coastal region like Mombasa, Kilifi. In these counties we have the sickle cell disease gene, and some of us are carriers of the sickle cell disease trait. And for example, if there's a carrier of a sickle cell disease trait, marries a carrier of a sickle cell disease trait, there's a chance or a possibility that you can get a baby with the sickle cell. And when you get such a child, one, it's not a curse, it's something that's alive in our society. And what is needed is for someone to ensure that this child gets proper care, proper management and treatment, and they get good psychosocial support as they grow